Healthcare is, at its core, a deeply human experience. Our health shapes every aspect of our lives and the lives of those around us, making it profoundly personal. So, what happens when this inherently human industry intersects with cutting-edge technology? The result is not only fascinating, but at times can be deeply, deeply impactful. Today, we're diving into the transformative role of technology, specifically AI in healthcare. And we couldn't have two better voices to guide us through this exploration. Joining me in this conversation is Brendan Fowkes, Global Industry Technology Leader for Healthcare at IBM, and my Converge colleague, Hanna Aljaliss, Vice President of Artificial Intelligence. Both are not only experts in understanding AI's impact on healthcare, but also bring a unique personal perspective with loved ones who've spent their lives in the healthcare field. In most industries, the appeal of AI often lies in its ability to save time. But in healthcare, time couldn't be more vital. Time saves lives. It's the lives of the patients and the lives of those you care about. Developing AI solutions in this space isn't just innovation. It's a profound responsibility, a task that carries both urgency and reverence. Hanna, Brendan, good to be with you. Brendan, could you start by introducing yourself and sharing a little bit about your current role at IBM?
Thank you. My name is Brendan Fowkes, and I'm our global industry leader for technology for the healthcare industry. So that includes all of payers, providers, governments, life sciences on a global scale, and how we use technology to solve business problems for those customers.
And you've been in this space for a while, right?
Yeah, I'm approaching my 30th year in some form of healthcare information technology. Started as a cache programmer writing HL7 interfaces for billing, accounts receivable, ambulatory physicians. I had a variety of roles from revenue cycle consulting to nurse strategy and scheduling to the past 14 years here at IBM.
So if it's kept you there for that long, I mean, there must be something about this that you absolutely love.
It's the opportunity to affect a patient on the other side, a member, a caregiver. I wasn't any good at biology, so being a clinician wasn't really an option. So that altruistic mission of how can we use technology to just reduce complexity, so at the end of the day, somebody feels more comfortable navigating the healthcare system, because it's as complex everywhere around the world as it is here in the States.
No, absolutely. It's definitely challenging. I mean, given that you've worked across payers, providers, and governments, I mean, how have these different perspectives shaped your approach to helping organizations solve problems in their space?
I think it's really allowed for the opportunity to leverage ideas from outside of an individual vertical. A lot of times people look at, I have this small problem, I'm going to do this little thing and fix my one little issue. If you start looking at a more holistic view, then you can look at how you can collaborate. And that's some of the things we're talking about now. We're using this sort of coining this term called collaborative AI. And how can we start to pull the members of the ecosystem together in order to affect change?
Given your experience working alongside hospital admins, and you've seen them, I'm sure, be introduced to advancements like electronic medical records and now analytics in AI and generative AI, how have you seen this adoption historically evolve in the healthcare industry?
I joke about how long I've been doing this, that things were on paper, and we had to convince people that there was a medication administration safety outcome if you put in this system. At the end of the day, I think the old book was To Err is Human, was that book by the Institute of Medicine back around Y2K, I date myself, but somewhere around that time frame, and where the investment in medical records could save patients' lives. Then you could get them to move. Same idea. If we start risk stratifying patients, can you give them an outcome? And now as you look at the advent of AI, I think that's really the journey we have to help them go down and eliminate some of the nervousness that at the end of the day, we might be able to better affect the patient's life. And I think that's kind of, the message is the same. The technology's been very different along the way, but the transformation opportunity is really there.
Hanna, we know each other. But for our audience, would you mind sharing a little bit about yourself and what is your current role here at Converge?
Thank you, Jonathan. My name is Hanna Aljaliss. I'm the Vice President for Cloud Data and AI here at Converge. So I have the privilege of sitting at that intersections of the three superpowers of innovations, cloud data and AI. I work with our customers to harness the power of these great technologies to build new solutions or address some challenges that they face today in their business. I know the topic today is about healthcare, so healthcare is a primary focus for us here at Converge. I personally spent a great deal of my career building solutions and innovations in this industry, whether for payers, providers, or pharmaceutical industry.
Based on our conversations earlier, Brendan, I know your mother was a nurse, and Hanna, your wife is a physician. My mother and sister-in-law are all nurses. I know I definitely have a unique perspective, but I'd love to hear your unique perspective on how that's informed how you've advised your clients.
I think it is one of those things, and I think Hanna and I have talked about this numerous times because the collaboration between IBM and Converge is awesome, is the way that whatever we do, how can we make a caregiver's experience a little better? As someone who wrote some of the early systems, that's not what we did. I don't think we made their lives easier. There's been a lot of advent to try to make it a little bit better and a little bit easier from the clinicians.
No, you're absolutely right. Spot on. It's all about that kind of clinician experience and also the patient experience in this whole things. Like, as you said earlier, Jonathan, like my wife works in as a primary care, and she's one of the most hardworking people I've ever met. I've seen really how overwhelming her space could be. I mean, there are two areas where I really just surfaced, and I know Brendan and I spoke about this before. There's a lot of administrative kind of work that physicians have to go through and do to just get going, right? And that's not where we need, for example, our physician to spend their time. We need them to spend their time with their patients. But if you look into their world, it's extremely overwhelming with a lot of administrative related work, such as kind of like documentations, care coordinations, such as referrals, lab results, dealing with insurance companies, billing, authorizations, and so on and so forth, right? I read an article the other day that says like on an average, like for every hour a physician spent with their patients, there are 2 hours of administrative work that they actually have to do to get by and get paid and get the process going, right? So that's really shouldn't be the case. I mean, we agree that technology could solve a lot of these administrative work that clinician has to go and do on a daily basis. I think we're living in a moment where I think we have technology that now started to get introduced into different aspects of this in this domain, which can actually become a game changer. The other area where I also see there is a great opportunity is that in this domain, I think there's a lot of information overload for physicians. I've seen my wife how sometimes like she gets some complicated cases that patient history could be around 100-page documents that she has to go through to understand, what exactly going on with these patients. And so they have to process information, a lot of information at a very fast pace, and they also have to keep up with everything going on in the medical space, from clinical research to recent advancement in drugs and therapeutics and recent regulations and things like that nature, right? So trying to kind of simplify access to information to doctors and physicians and could be also a game changer for them to help them make better clinical decisions and help them, of course, improve the outcome of their patients and the people who they care for.
The goal of a doctor, right, is to help their patients. They do need that time to invest in understanding what's going on. And I can definitely see how, while administrative tasks are necessary, they also can hinder them from doing the thing that they love the most. Speaking of things that people love the most, Hanna, can you tell me about a project that you're particularly proud of?
As I mentioned, I spent a great deal of my career working in this healthcare industry. So earlier in my career, I actually worked on large projects for a large pharma company to streamline their order to cash process. in particular around what they call it specialty drugs. Those are kind of drugs that are considered time sensitive and critical in the sense that they have to be delivered in a very fast timeline in order to address some kind of severe cases. Like, for example, one of the drugs or medications that this company used to manufacture is really around a rare kind of bleeding disorder disease called hemophilia, which is basically some sort of a disease that prevents blood from clotting when you get a cut or when you get basically severely injured. And like if people basically have this kind of disease and they don't get the medication on time, this could be a life-threatening situation. So the project we worked on was to streamline, in partnership of course with IBM back then, in 2008 actually. We implemented an integrations between all these different systems, their order system, their billing systems, their warehouse systems, and bringing all these kind of like system together to streamline the process. And one of the most rewarding and like these profound moments in my career, when we delivered the projects and it achieved the outcome, we got a note from the CEO of that company thanking us and showing his gratitude for the solution, and basically saying that, I don't know if you guys realize that this is really not just about the technology and the fun of the technology. There are people you're saving their lives by getting their medications to them on time faster than what we can do today. So that moment, that kind of email that we got was that aha moment in my career where I realized like healthcare is a domain that any impact or any solution you deliver or any innovations you build in this domain could have a profound impact on people's lives, and in some cases saves lives as well. So that's why I started to get passionate about this domain and building solutions in this domain, because it has this amazing impact on people's lives.
Yeah, I guess when improving the bottom line is improving people's lives and increasing their lifespan, that's a game changer, right?
Yeah, it's one of those things you can do good and do well at the same time.
So if we were to step into a time machine for a moment, you've both been in the field for a while. How have you seen AI, machine learning evolve in healthcare since the beginning of your career to now?
So I think the big thing is early in the career, the data wasn't available to do real innovation. The innovation was around process transformation. It was people. You studied the nursing workflow, you studied the health plan workflow, and you tried to improve the people because you didn't have the data. With the investment in the global investment, electronic medical records, with the closest thing to adoption of integration and almost interoperability with the FHIR standard, we're seeing data move around in a new way that's allowed us to start to think differently about what could we be doing. The other thing that's important is when we think about AI, it doesn't have to be a huge, big, foundational generative AI model. We're talking about simple predictive modeling, machine learning. It doesn't have to be this big thing. It can just be, for some people, it's advanced analytics. So we've seen that move in what I've really seen is the idea of some really talented data scientists at academic medical centers working on the holy grail of predicting sepsis and predicting readmissions. The other thing is the idea of innovation centers. Here's a place where we can experiment and maybe we'll use some of it over here in the system. I see that globally. I was with the innovation team at Dubai Health a few weeks ago, having this exact conversation. How do we go fast over here and cherry pick what we can use in the system in a conservative way at the end of the day?
You're right. Sometimes the highest value doesn't necessarily use the biggest or latest and greatest models, right? It's whatever delivers the greatest and best outcome for the patients. So we are in this new generative AI age. I definitely have seen the value of traditional machine learning models in healthcare. Can you share examples how you've seen generative AI transform workflow automations in healthcare, whether it's in their care or administrative process?
It's a very exciting time that we live in, right? And I can mention innovative solutions that we also worked in partnership with Brandon and his team on a year ago or a couple of years ago around prior authorizations. Just to give you an example, like prior authorization is a use case that has been available forever, right? In the healthcare industry, it's a cost control mechanism put by health plan to ensure doctors don't overprescribe some sort of costly procedures. But it's basically at the same time very time consuming for physicians. It could delay access to care for patients, which can be consequential. And it's been kind of like going on forever, right? So we partnered with IBM about a couple of years ago to kind of rethink this way or this process with this new technology called generative AI. So we said, what if we can basically start to simplify access to information to the doctors by taking those plan documents, taking all the kind of requirements that the doctor needs to know to understand what requirements, what evidence they need to provide to get this, let's say, particular prior authorizations approved in a very fast manner. So we leverage AI to kind of, process these kind of plan documents and regulations and then extract the rules that highlight what are the requirements that the doctor needs to know or what are the evidence the doctor needs to know before submitting a prior authorizations. Because part of the reasons right now where this process is problematic because it's a black box. Doctors don't need to know what they need to provide to get a particular prior authorizations approved. So that's one step. And then the other step to say, what if we could actually now take that EHR record for the patients, which exist in multiple EMR systems, and then try to kind of see if these patients meet the criteria for that particular prior authorization. But you could do that with generative AI as well. So Brendan always used the examples of bariatric surgery. Like if I understand, okay, for bariatric surgery, for example, I need to have the patient with certain BMI level, with certain multiple comorbidities and certain conditions, I could look into the patient medical records because it's all digital, and then try to see if this patient meets the criteria and highlight where the patient basically doesn't meet the criteria and provide those information to the doctor in real time so the doctor can add notes or can provide additional evidence to support getting this approved in a timely fashion. And that was kind of a big revolutionary kind of solutions to bring a process that could take weeks today or days, basically, in some cases, into minutes using this great technology. And as Brendan said, it's like what exactly you're achieving here. You're achieving shortening the timeline of a process that could means basically someone getting their cancer treatment on time, someone could getting some sort of diagnostic in timely fashion so that they don't basically, because any delay in getting the care could have, consequences on this patient's life. And by getting him access to care in a faster timeline basically can mean a lot for these patients and of course for the physicians. This is a problem that costs the healthcare industry today around $500 million just on the provider side. So imagine the impact of such a solutions. But again, change is hard. And when you're dealing with an industry, there are multiple entities involved to make this happen. You got the providers, the payers, and sometimes the pharma, right? All of them has to come together to adopt such a concept or such a solution. So despite the fact that technology is available and the solution is available, just getting the change done in time and integrating all these systems is really where the challenge could be around something like that.
Yeah, and I think the important thing, the automation opportunity with that is, this is for a really complex patient. You mentioned a cancer patient, multiple comorbidities. There should be collaboration between the two teams. If they're not wasting their time on the simple tasks, then they can actually have a plan and collaborate to provide a better outcome to a patient. That's what they all want to do, as a better outcome at a lower cost. But everyone gets lost in the simple and almost, how do we automate the happy path, for lack of a better way of putting it? How do we get some of these simple ones out of the way? Bariatric is not simple, but it's something that could probably be automated 85, 90% of the time easily, and it's not. So both sides of the fence are wasting time asking for prior auths that aren't needed, working on ones that should be easy, and you just sort of go in circles. If we can eliminate that, that's going to allow that collaborative ability on these complex patients with deep family histories, everything, for them to actually work together and have the bandwidth to do it.
As we were talking about earlier, oftentimes these physicians need to sit down and review hundreds of pages of information and identify key pieces from it. So what I hear you saying is that this technology is an accelerator to helping them find those critical pieces of information, potentially automating it, but at the very least, it's decreasing the amount of investment into just looking for things and quickly bring things to their attention so they can focus on crucial problems and provide better care for patients. While some may view technology as just another tool for cost control, as we've heard, its impact is so much greater. What we're truly witnessing is technology as an accelerator, a powerful means to speed up the delivery of critical information to doctors and practitioners alike. Few developments in AI feel as noble as this. Yet, as Brendan and Hanna highlight, the automation of healthcare is a two-edged sword. The potential to do good, save time, and ultimately lives is extraordinary. But without the right guardrails, the risk of harm grows equally significant. Developing these solutions is a delicate balancing act, one where the stakes reach far beyond the traditional bottom line. So, what are those stakes? What are the goals of today's healthcare professionals are striving toward? That, my friends, is the Quadruple Aim. And it's exactly what I'll explore with Brendan and Hanna next. So when we were preparing for this podcast, we were introduced to the Quadruple Aim, which is built on its predecessor, the Triple Aim. For listeners who are unfamiliar with this, can you explain what the Quadruple Aim is and how AI influences the areas it addresses?
Yeah, and I think this is an important one. And this is one, back to that global point of view, is it doesn't matter how healthcare is funded and financed. At the end of the day, the goal is the same. We want to improve patient outcomes. We want to decrease costs because it doesn't matter who's paying for it. We want to increase access, that people can get care they need. And then the last one is the experience. So that was the initial triple aim. And then they added the experience from both the patient and the caregiver. So at the end of the day, it doesn't matter who I've talked to anywhere in the world. That's the end goal. It all comes back to that. It can be a large publicly traded health plan here where, yes, shareholder value matters, but the only way to drive shareholder value is somewhere moving the levers on one of those four major initiatives. I was working with the Veterans Administration. I was talking to one of the innovation leaders at one of the VISNs, and he goes, remember, if we do something, think about a surgical glove blown up. If you squeeze two fingers, that air goes somewhere, and the experience gets bad for somebody else. So you have to be thinking holistically, just because you made something better here, what is the downstream effect to the rest of my organization? And are you going to burn out nurses over here because you made these scheduling people's jobs better?
This fourth point helps us reflect on the people that are helping other people's lives, improving their lives as well. And improving those caregiver lives. As many people know, healthcare is a heavily regulated industry, obviously because of all the sensitive information that's there, right? Cybersecurity is crucial in 2024, 2025, and keeping things safe and secure is critical. Implementing AI in sensitive areas like diagnostics or patient data management has its own unique challenges. What do you see as the key ethical considerations that people need to be concerned about?
Obviously, there are many things here, but the three most important things is, of course, like we know about data privacy, right? Because it's a very highly regulated industry, patient privacy informations and compliance with HIPAA and GDPR basically should be part of any system design that we put forth in these situations, right? Along with, of course, practices like encryptions, anonymizations, and access control are really important to factor into any solution we build into this one. And the second point, I think Brendan mentioned this, right? It's important to have this kind of human oversight, or call it, let's say, human in the loop concept about this. It's important to understand that this technology, I don't think the vision is to replace clinicians and doctors, right? It's more to kind of improve their quality of care and improve their lives and be more efficient, right? So having that human in the loop concept or design in mind as we build this system is always essential. And the third important things in my mind is transparency or explainability. As this model gets more kind of sophisticated and integrated into different systems in healthcare, a clinician needs to understand how do you trace the answer that was given or the decision that was given to a clinician to a source knowledge system or a knowledge article. So they call it explainable AI. Basically, it's a core aspects of designing healthcare AI solutions for healthcare to ensure decisions are clear, justifiable, and can be validated. Basically, that can lead into fostering more trust and accountability in this particular industry.
Those are three key foundational pieces. And just two add-ons, because I spent a lot of time talking about AI and AI ethics. The two things are, one is bias. There's no data set in the world that's probably more systemically biased than healthcare data, of access, affordability, all the things we're working on fixing. And we did a project around an ED admission for uncontrolled diabetes 3 months in advance with a large health plan a few years, about 2-3 years ago. And when we got all excited, we finally sat down and said, okay, now we're kicking off this project. The project manager said it best. He goes, I don't need a model that's 92.5% accurate for one population. I need something that's 78.6% accurate for all the diverse populations that we serve. Because right now my care managers have nothing, so they'll be happy with that. We got to 81.6. So, but it was a great mindset to remember that you have to really study the data before you deploy anything to ensure you don't run into it. Because historically, a lot of healthcare data was based on people that look like mid-50s, employed Caucasian person. And that's affected the way they care for women, let alone. So there's a lot of these things, and that's just so out there now. But how do you automate that? And then the last thing on the ethics is governance and compliance. Hanna mentioned HIPAA, GDPR. There's now the California Patient AI Privacy Act. That is law. Connecticut's about to pass. Colorado passed. There's 16 states, either with something already passed or something about to pass. And you have to monitor all of that and stay compliant. So if you're one of these huge health systems, you have to monitor for every state. Health plans, you have a customer like Boeing, they probably have employees in every state. You have to be able to automate that governance that when I tested the model, the training set, the day it scored, the score it got, why it did it, be able to hit a button and say, no, see, we're completely compliant with the California law. And so on top of all the things we talked about, monitoring bias and monitoring governance are things that are going to be really important as we go from millions of pilots happening into real production scalable use cases.
Right. And it's important, one of the impediments of, adoptions in AI in this industry, because there's still like a lot of lack of regulations, a lack of guidance from government agencies about how basically to adopt it in a responsible and ethical fashions, and what are basically the liabilities some of these companies may have leveraging these models, let's say in a front office situations or some sort of mission critical situation. So I think I agree with that. As we start to see more states and of course, hopefully the government start to set forth how those systems should, how the AI should be adopted in this particular industry, I think we're going to start to see more adoptions and wider kind of scale of use cases in place as well.
Both of you have helped build solutions in healthcare industries, and over the past 8 years, I've helped in healthcare and others build solutions that leverage machine learning and AI. What advice would you give to those working with healthcare professionals to ensure, as they work with the teams building them solutions, how do they better collaborate to build the right solution? Like you said, Brendan, there's a model built for 91%, but in reality, the level of value really was just at 78%. It sounds like you need good collaboration from those on the AI side that know AI and those that know healthcare.
Yeah, I think you just said it. The word you need is collaboration. And the people that are going to adopt this need to be involved early. You see a lot of forward-thinking organizations have sort of innovation days. Everybody come in and tell me what you think you might want to do. because there's no lack of use cases now. I've been on calls. They're like, yeah, we have like 200 of them. Okay, well, that's not even remotely a good place to start. But the collaboration between the business and IT, for one, the business value. What are we going to make, whether it's patient outcomes, cost, experience, whatever, and then the feasibility. It's really an approach of building the right solution that's feasible to deploy, because if it's based on data that you really can't get and it's going to be really expensive, it's somewhere in a different system or someone doesn't have it, it's not feasible. You could do a pilot on 40, 50 patients, but you can't scale it to 200,000, cost, whatever. Really understand the feasibility at the end of the day. But it is a collaboration, 100%, of what are we going to innovate, what are we going to automate, and who's going to see the value? And then actually, can we do it?
Indeed. So if I handed you a magic wand right now to create the ultimate AI solution for one of the challenges that you've seen, what would you wish for and why?
It's a great question. It's actually in the nirvana of this idea of basically the future of AI and healthcare, right? So if you think about it, like we as a human, we generate tons of healthcare related data, whether, from, let's say, going to see a doctor's, doing, let's say, some imaging, your lab results, data coming from your wearable devices, from your phone, everything, right? So on average, I think a human generates around between 500 to 800 megabytes worth of data annually, right? And if you look into all this data, it's kind of scattered all over the place. It exists in some sort of EMR systems. We have many of them. It exists in some clouds and exists in your devices, exists everywhere, right? So in my kind of nirvana world of healthcare, like integrating all these different silos of data sets across you as an individual, and then putting AI on top of it to provide you a more personalized kind of health plans and kind of tailored diets for you, and then providing the same information to your doctors to help them understand more about you as an individual, and then help them make better decisions for your health. I mean, this could be like a game changer for the industry. And again, it's we're talking about the magic wand, right? I know it's a super complex things because your data is the key to that. And if we find a way to kind of bring all these silos data that exist right now everywhere into a place where you can now put AI on top of it and start to bring some innovative and great insight out of it, this could be my ultimate dream in this particular domain. So I don't know, Brandon, what do you think?
I love that use case, because I think if there's been 100, there's probably 500,000 personal health apps on the App Store, Google Store, whatever you want to call it. But they fall down because of that lack of data. I use some things like Strava, Map My Ride, things like that. Those are helpful, but if there was a more comprehensive view, it would help even further. I actually think of more of people like Hannah's wife. Because you think about a primary care doctor, they walk in, and that 1 hour for patient, 2 hour administrative, they have so little time. They have 15 minutes with Jonathan. They stop before they walk in the room, take about 30 seconds, and say, okay, I remember, I've been seen, okay, and walk in and start making diagnoses. What if that 30 seconds or 1 minute was a comprehensive view of, back to the data, like everything about you, what you've come in with, but also a diagram of patients like you that the doctor has seen and treated in the past 6 to 9 to 12 months, and what they did and what was the outcome, red, yellow, green. Still not making a decision, because that's what the clinicians do. They look at you, you walked in, they go, okay, when I saw someone like Jonathan like a week ago, we did A, B, C, D. Now, how do you, that knowledge is in there. How do we surface it in a workflow and summarize it in a way?
That's why they call it a practice, right? Because each clinician is collecting data on a daily basis that informs successive decisions over the course of their career. And so what I think we've landed on is we have the physical you that needs the treatment that walks into the room. And we want to empower clinicians with the digital you to be able to see past just the physical you, but see the actual you that you've been for X period of time and have a much better 365-degree understanding of the Brendan Fowkes or Hanna Aljaliss that just walked into the room saying, I got a stomach ache or I've got a headache, because they'll know based on that digital you, well, Brendan wakes up and goes cycling every morning, and this is his diet because he tracked his food, and therefore these things are off the table, and they've got a better information of not only, like you said, right, about yourself, but also everybody else that acts similar to you and the challenges they faced, right? So it's bringing our collective experience as humans together digitally to inform clinicians' ability to provide the best care possible. That's what it sounds like. So to wrap things up, if our listeners could take away just one thought about AI's role in healthcare from our conversation, what would you want it to be?
You don't have to go solve and create the new molecule for the latest cancer. You can just automate the intake process. Just go. Come up with anything that you think is going to relieve a burden in the system and go. Let's go do it. Doesn't have to be big. It can be small.
Yeah, I agree. And I mean, there's a lot of waste in this industry, and we know it, right? We've seen it. We talk to our clients in this space, right? As Brendan said, like, your idea doesn't need to be like how I can use AI to cure cancer tomorrow. Despite that, there are some efforts to use that. But I'm saying there's a lot of waste, a lot of things that you could go after to reduce the burdens on doctors and basically offload some of the costs that we incur today, because we pay for these health insurance at the end of the day, right? And the cost is passed to us. So if you can go after the waste in healthcare, reduce burdens on doctors, empower them with better tooling and insight to help them basically spend more time with the patients, focus on the outcome and the quality care that they can give, and less on the administrative tasks, that to me is really the one takeaway that I would say for pretty much all the listeners who are different participants in the healthcare system, whether on the payer side, the provider side, or the pharma space.
Gentlemen, it's been a pleasure spending this time with you. Thank you so much. This conversation with Brendan and Hanna was full of insights that deserve to be front and center in any discussion about AI in healthcare. Together, they've given us a clear end goal. Can we harness the digital you, the countless data points tied to your personal health, and streamline it to support the physical you? The version of you sitting across from the doctor, seeking to be understood and receive the best care possible? Care that considers every facet of who you are. While there may still be a long road ahead, we now have a North Star, a guiding vision where technology doesn't just exist, but actively works to improve human lives. Thank you for joining us on this episode. For more information, visit our website at convergetp.com, and don't forget to subscribe to Edge of IT on Apple Podcasts, Spotify, Amazon Music, or wherever you listen to your favorite shows.